This is a CBS News special report. I'm Ben Tracy in Washington. President Biden is delivering remarks at the White House and will receive his COVID-19 booster shot. The president's third shot is in line with the CDC and FDA's new recommendations. Let's listen to the president.
That's because the Food and Drug Administration, the FDA, the Center for Disease Control and Prevention, the CDC, looked at all the data, completed their review, and determined the boosters for the Pfizer vaccine, others will come later, maybe, I assume, but the Pfizer vaccine are safe and effective. They've had all the data they need. And last week they laid out who is eligible for those boosters for now. You're eligible for a booster if it's been 6 months since your second Pfizer shot, and if you fall into one of these categories. People over 65, which is hard to acknowledge, adults, I'm only joking, folks, adults with certain underlying health conditions like diabetes and obesity, and those who are at increased risk of COVID-19 because of where you work or where you live, like healthcare workers, teachers, first responders, grocery store clerks. If you fall into these categories, you're eligible for the booster. Now, I know it doesn't look like it, but I am over 65. I wish I way over. And that's why I'm getting my booster shot today. The booster line is if you're fully vaccinated. The bottom line is that if you're fully vaccinated and you're highly protected now from severe illness, even if you get COVID-19. You're safe, and we're going to do everything we can to keep it that way with the boosters. But let me be clear, boosters are important. But the most important thing we need to do is get more people vaccinated. The vast majority of Americans are doing the right thing. Over 77% of adults have gotten at least one shot. About 23% haven't gotten any shots. And that distinct minority is causing an awful lot of us, an awful lot of damage for the rest of the country. This is a pandemic of the unvaccinated. That's why I'm moving forward with vaccination requirements wherever I can. On Wednesday, I'll be traveling to Chicago to talk about why it's so important that more businesses are instituting their own vaccine requirements. We know that to beat this pandemic and to save lives, to keep our children safe, our schools open, our economy going, we need to get folks vaccinated. So please, please do the right thing. Please get the shots. And it can save your life. It can save the lives of those around you. And it's easy, accessible, and it's free. So text your zip code to 438829. That's 438829. Or visit vaccines.gov to find a vaccination location near you. We can do this. Get vaccinated. Thank you very much. Now I'm going to get my booster shot. And right here, and the major is going to give me the shot.
Did you have any side effects with the second shot, Mr. President?
No, I haven't any side effects the first or the second shot, thank goodness. I don't anticipate one now, but we'll see. Is that high enough for you? Okay.
Is the First Lady giving hers as well today, Mr. President?
She's going to get one. I think she's teaching, but she's going to get one, yes.
Mr. President, what do you say to world health leaders like the World Health Organization who say wealthy nations should help more countries without vaccinations get vaccinated before they get boosters here in America?
We are helping. We're doing more than every other nation in the world combined. We're going to have well over 1,100,000,000 shots, and we're going to continue going. We're going to do our part. We've also given a great deal of funding to COVAX, which is the vehicle that does this. So we have plenty of opportunity to make sure we get everyone in the world to play our part, the largest part in the world of getting everyone vaccinated.
How many Americans need to be vaccinated for us to go back to normal? Like, what is the percentage of total vaccinations that have to be deployed?
Well, I think we get the vast majority, like is going on in some industries and some schools, 97, 98%. I think we're awful close. But I'm not the scientist. I think, but one thing for certain, a quarter of the country can't go unvaccinated, and us not continue to have a problem.
Any progress on a reconciliation deal today, Mr. President? How close do you think you are?
You know me, I'm more an optimist. I think things are going to go well. I think we're going to get it done. And I have meetings tonight, tomorrow, and for the next little bit.
What is at stake for your agenda and your presidency with what's happening on the Hill this week?
Victory is what's at stake.
Mr. President, how would you define success this week legislatively? How would you define success legislatively by the end of this week?
Well, it may not be by the end of the week. I hope it's by the end of the week. But as long as we're still alive, we got three things to do: the debt ceiling, the continuing resolution, and the two pieces of legislation. If we do that, the country's going to be in great shape. Thank
What's
you.
your message to Democrats as you have these calls? What's your message to Democrats, Mr. President?
You just saw President Joe Biden get his booster shot of the Pfizer vaccine at the White House. He took some questions there through his mask. He was saying that he had no side effects from the first or second dose and does not expect side effects from the third. He was also asked if the First Lady will be getting a booster shot, and he responded that she would, but she's teaching today, so that's why she's not getting one there. Let's bring in Chief White House correspondent Nancy Cordes. Nancy, this was a last-minute addition to the president's schedule today. Why did the White House decide to do this and do this so publicly?
A couple of reasons, Ben. First of all, the president wanted to set an example now that the FDA and CDC have determined who is eligible to get a booster shot. He wanted to be there first in line to show the American people that it's a good idea. Beyond that, this White House has been looking for opportunities to advertise who exactly is eligible for a booster shot to kind of clarify some of the arguments they were making initially. Early on, last month, the president was saying that he wanted everyone, all adults, to be able to get a booster shot starting this month. But he had to dial that back when he started getting signals from the FDA that they didn't think that that was actually medically necessary. So now we have a narrower cadre of individuals who are eligible, people who, like himself, are over 65, those with underlying medical conditions. And so he's looking to be out there in front to clarify exactly who should be getting a booster shot right now and who shouldn't.
Nancy, thank you. Medical contributor Dr. David Agus joins us now. Dr. Agus, there's been some confusion about this rollout of this booster plan, whether or not the data supported it. Do you think the president did anything there to clear some of that up?
Yeah, I mean, he had to take a bold step forward. He is 8 months from his second shot. And so when you're losing about 6% of immunity per month, you need to keep that immunity level high to fight Delta. I think the data are very clear that in at-risk populations, you need to have a very high level of immunity. And the only way you get there is with the booster. And we've seen data from Israel and now Europe that shows similarly. And so we're rolling it out here in the United States. I hope we can get the right people with the vaccine soon.
All right, Dr. David Agus and Nancy Cordes, thank you so much. Our coverage continues on our 24-hour streaming service, CBSN. You can watch it at cbsnews.com or download our CBS News app on your cell phone or your connected TV. There will be more on your local news and tonight on the CBS Evening News. This has been a CBS News Special Report. I'm Ben Tracy in Washington.
For news 24 hours a day, go to cbsnews.com.